Good morning, good afternoon, everyone. Thank you for joining us from wherever you are. We're just going to give it a minute as a few more people join in, and then we can start. We're so glad that you have spared time to join us in this webinar on operationalizing multisectorial nutrition action plans at a subnational level. As you join in, please note, slide. This is a translated webinar. We'll be translating into Arabic, Nepali, and French. And we're very grateful for our translators. That's 𝗙𝗿𝗃𝗵𝗃 and Rashid, who are in the background helping us with this. Please go to the globe on your screen, select interpretation, and select a language that is feasible for you. And you will be able to listen into your preferred languages. Thank you. Slide. Please do try to keep your videos on mute and your voices on mute. Just to let everyone know, the webinar is being recorded and the slides and any other additional information that is shared will be shared with you and also posted on the website as soon as we're done with the webinar itself. As you join in, please introduce yourselves in the chat, your name, where you're listening in from, so that we get to know each other a little bit more. As I've already mentioned, please do keep your mics and cameras off. This helps us to save bandwidth for some of our attendees who may not have very good bandwidth. For all your questions, please do put them in the Q&A box. It is somewhere next to the globe icon at the bottom of your screen for those who haven't seen it yet. And some of the questions maybe will be responded to directly in the chat, or others will be responded to during the session on the Q&A. During the Q&A, you will also be able to speak, so please raise your hand and mute yourself, and then you engage with the panelists. If there are any other issues that you have, any challenges, if you have challenges hearing, clarity, questions, comments, please put them in the chat, and there will be people in the background that are helping us with this support aspect. Thank you. Slide. We definitely would not do this without supporting donors and several of the actors and partners that we've been working with that are engaged in multisectoral planning actions in the 3 countries that we'll be hearing from. Next. Interesting webinar. We will have a brief introduction to planning or about the GNC sectoral planning toolkit. Then we will have presentations from the 3 countries, and these will be Yemen, Nepal, and Ethiopia. We will have a plenary session. Then we will go on to have an open Q&A session. And finally, we'll close our webinar. So why are we here today? Why are we having this discussion? We want to be able to provide a brief overview of the tools available for subnational assessments and planning for nutrition. We want to be able to have the 3 countries share experiences in multisectoral nutrition assessments and planning at a subnational level. And hopefully we can be able to end this discussion with a better understanding of how do we move from piloting to more coverage for subnational level assessments and planning, what mechanisms should be developed or capitalized on in supporting countries in engaging in multisectoral subnational level planning. Next. Who are we conversating with today? We have a very exciting list of panelists and facilitators today. We have the beautiful 𝗙𝗿𝗶𝘀𝗵 all the way from SUN-Yemen, who will be sharing us the experiences that they have had with multisectoral planning. We have some and Binod Sa all the way from Nepal. 𝗙𝗿𝗶𝘀𝗵 is from Action Against Hunger Nepal, which has worked very closely with the and they will be giving us the experience on the multisectoral plan. 𝗙𝗿𝗶𝘀𝗵, who is the technical advisor, hosted by Action Against Hunger, but is hosted to the Ministry of Health in Ethiopia and is in charge of the nutrition-centric humanitarian development peace nexus. We will have Rita share with us briefly about the Elrha tool that is also being used for multisectoral planning. Rita is not only sharing with us a tool, but is co-facilitating the session along with me, Martha Nakakande, who is with the GNC. Without taking too much time, we will go into a brief background of why we are here. Subnational planning. Why are we talking about multisectoral subnational planning? So many countries are actually doing subnational planning. They have developed, national level multisectoral nutrition strategies and action plans or result frameworks. The SUN recently reported that over 31 countries have developed these strategic plans. However, getting things done, getting from paper to action, from action to outcomes, still remains a very complex issue. And a recent report, 2021 report actually by the World Bank, reported that operationalizing these multisectoral nutrition programs still remains a challenge. There is a lot of aspects that hinder this from happening, but most of them rotate around one, gaps in capacity between translating a national policy into action. The other is about the institutional coordination mechanisms at all the different levels and the overall challenge of getting the different sectors to come together, to sit at the table and be able to say, how do we work together? Not just in words, but in actually getting the work done together with all of them focusing on one united outcome. So many countries have come out seeking for support in this area. And the GNC has developed a tool for multisectoral subnational planning, and along with many other countries that have also developed several tools, like the Elrha team Rita will be sharing us one of the tools. The development of our tool rose from the need to support really alternative approaches to the management of moderate wasting, which is like the narrow aspect of it, but it is such an interesting tool that can actually be used broadly for nutrition. And having used that tool, I actually believe it can be used beyond nutrition. Even other sectors could actually use principles behind it to be able to do multi. And the way it works overall, it's based on the basis of using as local as possible of the understood context, the determinants on the ground to the lowest level possible, and then looking at existing resources and saying, how can we use these resources? Do we want to prioritize certain aspects of these resources? Do we want to work on promotion with regards to these resources? Do we want to tweak the programming, or do we want to tweak how we're using these resources to address the priorities that you will have come up with, depending on the determinants to establish priorities? So the GNC tool was applied in Nepal and Yemen, and those will be sharing with us their experiences. just to briefly go through how the whole toolkit works, it has several phases, but the first phase is really the preparation phase where you have to really identify all the key stakeholders, both those directly into nutrition programming, but also those are under direct or interventions. Then you have to identify what your goal is, who are your target groups, be as specific as you can. And then the other most important part, which we'll not be discussing today, is to determine what is causing malnutrition at the lowest level possible. What are those determinants? You could have existing data, but maybe this is, regional level data. This is district level data. This is country level data. But beyond the figures that you have, what is actually leading to malnutrition in this area? And what we did within the GNC, we developed the rapid nutrition determinants assessment, which we're not discussing here today, but the link can be shared with you. And it's such a very exciting process where you really end up having to go all the way to the local level and engage with the community members and say, we are seeing these problems, but which of these do you actually want to prioritize? Which of these is really the most relevant and important cause for you for malnutrition? And you gather all this information and come and sit together with the stakeholders that you got right from the beginning to really identify, okay, what programs do we have in our area, in our district, in our municipality, whatever administrative section you want to be working with, and how could these impact the determinants that we have gathered from the community, and what should we then be prioritizing, and then understanding of the interventions that are already there. What do we want to adjust? What do we want to improve? What is missing and how can we do better? And then saying, okay, this is what we have in terms of programming. These are the resources that we have. So can we move on and say, through the way we are applying these resources or through these particular programs, we should be able to support a particular response. If it's moderate wasting, for example, as the Nepal team will be telling us, how do we look at this moderately wasted child from all the different sectors? And this that you see highlighted in red can actually be done in a single workshop. It doesn't have to be you having a separate workshop for mapping and all that. You can have a single 1 or 2 day workshop and have these discussions. But at the end of the day, you're trying to ensure that by the time you get out of this workshop session, all the relevant stakeholders, including most importantly, the local leadership, are all on the same page in terms of what we are prioritizing, why we are prioritizing it, what existing resources we have, and how we can tweak or change those resources to be able to support a given response or intervention. With this tool, you really want to bring people on the table, ask what is available, determine how you can address the prioritized determinants. Most importantly, we are talking about existing resources, which means we have to use local available financing mechanisms and tools, because at the end of the day, you want to make sure that whatever response you're planning for falls within the existing government structures and systems around planning and budgeting. As I've mentioned, we implemented or piloted this in Nepal and Yemen, and we're very happy that the 2 countries will be sharing with us today. And the link for this multisectoral plan will be shared at some point. We're still working on translating it, and hopefully we should be able to share it with you as soon as possible. Without taking too much of the time, thank you. Can we go to the next slide? I will not go into detail, but this actually is an example of how you can prioritize and create pathways to really show the key stakeholders that, hey, look, this is the situation on the ground, and this is how these various determinants are interlinked, and this is what we were prioritizing, or this is what has been prioritized in the community, and this is what we think we should go on. And through these pathways, the different stakeholders are able to really understand the linkages, but also the presumed or potential impact of the interventions in their different sectors. So I'll hand over quickly to Rita to share with us the decision tool. Thank you, Rita.
Thank you so much, Marta. So this is another example of decision tools. Hello, everyone. As Marta mentioned, this is another tool. It's a decision tool and resource package that you could potentially use. It's also to prevent undernutrition. And we're calling it the Advancing... So the AHEAD tool, Advancing Holistic Efforts Against Undernutrition in Crisis. So the tool really came from acknowledging how essential is preventing undernutrition in crisis, but at the same time, having some practical and evidence-based guidance that's lacking a bit or a bit scarce, and this is specifically on multisectoral response in humanitarian settings. And this is where this tool decided, this is where we decided to start with the AHEAD tool to really fill this gap. We decided to design it in an effort to support evidence-based, context-appropriate prevention programming across sectors, and we'll look at the various sectors later on, and also across actors. So we are translating global evidence into practical guidance for governments, donors, and implementers. How did we do the tool? So we started with a rigorous evidence synthesis that's also available on Elrha's website. We did a lot of consultations with global stakeholders, and we had an amazing international steering committee that we took, that gave us technical input as well. We grounded ourselves in the adapted Lancet framework that's tailored to humanitarian complexities. And we follow 3 steps in the tool. Similarly to the GNC one, the first step is to study the context in detail and the causal analysis. So we also look at drivers of malnutrition. The step 2 is to design the actual tool in a multisectoral way. And finally, to basically, it's about monitoring and evaluation. So that's step 3 that goes for the considerations and planning for MNE. Quick highlights. So the guidance focuses on pregnant and breastfeeding women and girls and children under 5. We have a lot of principles. We're going to see them as well later on, but it's basically about convergence and scalability within fragile systems, a locally led action, coordinated context-relevant responses, and also a cost-efficient action. So leveraging what we already have. So acknowledging that there is a response already happening, or there are resources and capacities already happening, and building from that rather than just starting from scratch. The tool has various elements. It's sector specific. We give a lot of delivery considerations, and we link to a lot of existing technical guidance and resources. So again, it's not starting from scratch, but it's kind of collating all the guidance that's available in one place in order to make the job easier for people who are implementing. And I'm just going to take you through the online tool for 1 minute just to familiarize ourselves with it. So this is the home page, and it's kind of divided into 3 sections. The first one is really the rationale behind everything that I've discussed. So like all the different elements, the principles, why did we choose them, etc. And then the decision tool itself. And finally, the case studies. I will not go through the case studies because we have amazing ones on the webinars today, including the Yemen one that 𝗘𝗿𝗏 is presenting, that also included in our decision tool. So from the introduction, I'm just going to show the Lancet framework because this is it's really like a nice summary of the decision toolkit. And we have here the various sectors. I hope you can see them clearly. So we are dealing with the health sector, the food security one, the education, WASH, and social protection sector. And this is where the different interventions will be in. We have the enabling factors still here. And then also the cross-cutting principles that I've mentioned some previously, but here is just some additional ones such as sustainability, so ensuring the project continues even after the immediate action is over, and then the alignment, for instance, with the standards for humanitarian action. The decision tool itself has the 3 steps I've previously mentioned. So for instance, in understanding, we just collated here all the various tools that you can use to do context and causal analysis, and everything is linked here. So again, to facilitate the job of implementers. In the design section, the interventions are divided into targeted, household, and community interventions. And I'm just going to take you through one example. For instance, the infant feeding support that goes through the modalities. So the how, what are the delivery platforms, etc. What are the core interventions? What are conditions and considerations for implementers? And finally, all the relevant technical guidance. So it really has everything you need in one place. Finally, the step 3, or the measurement, is where we collated all the process indicators. Again, it's for the different sectors. So here you can see any sector you like. You can go on the sector, press on it, and then you have the different example for monitoring indicators, the outputs, and the nutrition-related outcomes. So just going back to the presentation and the final slides. So here, what are the next steps? Our next steps is currently to pilot test the tool with a rigorous process evaluation, to potentially scale up to a CRCT, and then finally to evaluate feasibility, efficacy, and cost effectiveness. And these are just the amazing people behind the steering committee, and as well as the team that worked together with me on the tool. Thank you very much. And Marta, I'll hand over back to you.
Thank you so much, Rita. As you can see, there's quite a number of tools that we can work with. Over to you, 𝗘𝗿𝗶𝘀𝗵, for your presentation on Yemen. Thank you.
Thank you so much, and welcome everyone. So I am going to present Yemen's experience for the operationalizing of the multi-sector nutrition action plan at the subnational level. So on the next slide, I'm going to provide a very quick overview on the situation in Yemen. Next slide, please. So here you can see that we've been working on the previous slide, sorry. So we've been working on the multi-sector nutrition action plan since the Yemen joined the SUN movement back in 2012, and the first one was in 2014. Unfortunately, Yemen faced the political crisis, and the implementation was hindered. And again in 2018 to 2020, the second version of the MSNAP was also issued. However, we faced the COVID, so you can see that this is the third version of the MSNAP, and fortunately it was also operationalized for the first time. So this is the nutrition situation in Yemen. It is a catastrophic situation, and that's why the MSNAP is very critical, and that's why we keep working and trying to update it and also operationalize it. Next slide. So, next slide, please. Next slide.
Can you see the next slide, 𝗘𝗿𝗶𝘀𝗵? It's on the various years.
No. Next, please. Next slide. I've covered this because yes, okay. So you can see here on this slide that the outcomes of updating the MSNAP. So we have started with the humanitarian development peace nexus guidelines, And based on that, we have developed the common result framework and also the geographical prioritization tool, and then the implementation mechanism, which we call the accelerator program. And this was the beginning for the subnational implementation mechanism. Next slide. So here you can see that the overall overview of our planning for the subnational MSNAP, that we have started with a national consultant to do the subnational assessment. We identify the goal for using the subnational toolkit that was provided by the GNC, and we really wanted to operationalize the MSNAP in priority areas, districts in Yemen using the accelerator program methodology. And actually this was also part of the recovery and development plan in the country. So this subnational toolkit supported us to link the subnational planning that's going on recovery and development, as well as with the MSNAP at the national level. It was very critical because working at the subnational level will need to also establish the governance structure for the MSNAP at the national level, subnational level, and link it to the national level. So we have worked in two areas, in two governorates in Yemen, and in Taiz and Lahj. In the first one, we have covered 4 districts, and we managed to finalize 4 district MSNAPs and district level MSNAPs, and also the governance structure, the governorate coordination committee and district technical teams. And also in Lahj, we finalized 6 district level MSNAPs and also the governance structure. This process was really critical for us. It was a learning process, a step-by-step process. The total cost of the 10 MSNAPs per district is between $15 and $20 million. This was really interesting because when you look at the cost, it is like 40 to 60%, sometimes in some cases is wash. So it helped us also to understand the burden and also the contributions of the different sectors. Next slide, please. Okay. So this is an example of what's happening in one of these districts. This was the Taiz Governorate Accelerator Program. We have covered here, as I said, 4 districts. And then, the mapping exercise and also the malnutrition determinants analysis supported us to identify these determinants and also their pathways. Just an example here, you can see that the conflict and also the Red Sea crisis has impact on these areas. We have also the floods, the climate issues, the economic collapse, the gender inequality, and also displacement. It was really one of the worst scenarios and also the most complicated scenarios in Yemen. And we managed to also identify the 3 pathways and also develop the district level actions and also the platform for the governance. Next slide. So as you can see that we have actually started in areas with high burden of malnutrition, where we have stunting above 30 and wasting above 10% of population and children, and that that process was really a learning process, and that's why whatever we face as challenges, they are like lessons for us. So it was really a very helping tool because it was very simple, and we really covered 10 districts out of the 103 targeted districts in only a few months, and that's why it was an added value for us. Also, we managed to establish the governance structure for the first time at the subnational level and learn from this process how to engage the actors, and also what we need to enhance the government leadership at the subnational level. What are the incentives for not only the government but also the partners from the donors, the UN agencies, the clusters and everything. So these platforms actually is humanitarian development peace platforms, and that's why it was a very learning stage for us. As I said, the challenges in bringing together people, it was actually a learning for us. Mobilizing resources, it was one of the challenges, because to conduct the subnational workshops, meetings, definitely you will need resources. So it wasn't an easy job to ensure that we are providing and having the actors to invest in this process. The costing methodology was a challenging actually, because we don't have like a guideline for subnational costing. The toolkit helped us to go through the stakeholders mapping and also the programs mapping, but still the costing was a little bit challenging and took more time because costing methodologies within the stakeholders and actors. Maybe the third challenge is to maintain the national structure, functional, and also following on monitoring evaluation, and maybe these are areas for support. Next slide. So this is actually my last slide here, and really what we are planning to do is officially adopt this toolkit as MSNAP subnational planning tool, and also to integrate it within the SUN Secretariat in Ministry of Planning through having an expert supporting us to scale up. Adapting the toolkit with the stakeholders and having trainings is very critical. And as I said, to expand more more areas and also have more excited programs utilizing this localized tool is something that we are planning to do. The way forward, we would actually like to invest or to call our partners and donors to invest in SUN-Yemen approach that is nationally led and also supported by actors at the national and subnational level. Also investing in platforms that provide coordination support to countries and facilitate the sharing of experiences and learning between countries, such as the GNC and SUN-HDB Nexus Working Group, is something that we think will help us at the country level. The GNC, the SUN leadership, and donors are invited to help us through the implementation of the work plan of this working group. So I hope that was interesting to hear Yemen's experience, and look for any questions. Thank you so much.
Thank you very much, 𝗘𝗿𝗴𝗋𝗆. It's good to hear that the MSNP was operationalized for the first time in Yemen. We look forward to hearing that it has expanded to more than the 2 governorates. And you already have the questions in the chat. Please do put your questions in Q&A. Mohammed, I'm sure 𝗘𝗿𝗴𝗋 will answer to your question when we get to the Q&A part of the conversation. Over to you, Samyukta and Binod, sir, for your discussion on Nepal. Thank you.
Thank you, Martha. So from our side, we will have 2 presenters presenting simultaneously. So to begin, I can put in next slide. Yeah. So talking about Nepal at a glance, basically. So we are a landlocked country. We have diverse geography, having mountain, hill, and the Terai region or the plain region. So Nepal transitioned to the Federal Democratic Republic of Nepal after the 2015 constitution. And Nepal's governance system was restructured into 3 levels. So we have the federal or central government, we have 7 provincial governments, and we have 753 local governments, which are the municipalities and rural municipalities. And talking about the nutritional data, based on the Nepal Demographic Health and Nutrition Health Survey 2022, it shows that stunting is at 25%, while the nationwide wasting is at 8%. Next slide. So talking about the Moderate Wasting Initiative or MWI program. So under Nutrition in Emergencies, the Global Nutrition Cluster has supported the Moderate Wasting Initiative. It was implemented in 3 phases, which was started from June 2023 to February of 2026. So in phase 1, we conducted the Rapid Nutrition Determined Assessment Study, which was piloted in Nepal and Madagascar. So in collaboration with Nutrition Technical Committee and the IMAM Working Group, 3 study sites were identified. So we had the Badimalika Municipality representing the mountains, Sunil Smithi Rural Municipality representing the hilly region, and Mahagadimai Municipality representing the Terai. In phase 2 of the project, we focused on developing and piloting of a multisectoral intervention package for moderate acute malnutrition management with the local government. So this phase was implemented in 2 wards of 𝗘𝗿𝗃 municipality, where we delivered the package of intervention through community sessions and household-based approach. Next slide. So phase 3 of the program was a scale-up of phase 2, where we extended the intervention from a household-based approach to a health facility-based approach, ensuring local government ownership. So the health workers delivered the intervention sessions across the 11 government health facilities within all 9 wards of the municipality. Next slide. And this will be presented by Binod sir.
Namaste. Binod Mishra, Senior Public Health Officer, Health Section 𝗙𝗿𝗶𝘀𝗵 Municipality. नेपालमा कुपोषणको अन्त्यको लागि नेपाल सरकारले पोषणको सेवामा सुधार गर्दै पोषणमा सबैको पहुँचको लागि र मानव जीवनमा पोषणको चक्रको अवस्था सुधार गर्नको लागि नेपाल सरकारले 2080 10-14 गतेमा बहुक्षेत्रीय पोषणको अवधारणा ल्याएको छ। यसरी कुपोषणमा को चक्रमा पर्ने एज ग्रुपहरु मध्ये 16,000 दिनका आमाहरु, जन्मेदेखि 2 वर्ष मुनिका बालबालिकाहरु, त्यसको साथै 6 महिनादेखि 5 वर्ष मुनिका बालबालिकाहरु र कुपोषित बच्चाहरु पर्दछन्। यसलाई समयमै निराकरण गर्नको लागि नेपाल सरकारले पोषण रणनीति बहुक्षेत्रीय पोषणको अवधारणा ल्याएको छ। बहुक्षेत्रीय पोषण अन्तर्गत स्वास्थ्य, कृषि, शिक्षा, पशु, खानेपानी, सामाजिक विकास र प्रशासन सेक्टरलाई समेटिएको छ, जसले कुपोषण न्यूनीकरण गर्नमा सहयोग गर्ने गर्दछ। एसीएफ नेपालको आर्थिक सहयोगमा सहारा नेपालद्वारा बेलका नगरपालिका र स्वास्थ्य शाखामा एसीएफ र सहाराद्वारा मोडरेट वेस्टिङ इनिसिएसन कार्यक्रमको बारेमा समन्वय बैठक बसी बेलका नगरपालिका र स्वास्थ्य शाखाबाट बेलका नगरपालिका वडा नम्बर 4 मा यो कार्यक्रम गर्नलाई नगरपालिकाद्वारा सम्मति दिएको थियो। यो वडामा कुपोषणको बच्चाहरू विगतमा बढी देखिएको हुनाले यस वडामा कार्यक्रम गर्न सहमति दियो। त्यसपछि एसीएफबाट आएको रिसर्च टिमले 1 हप्ता लगाई तथ्याङ्क सङ्कलन गरी समुदायबाट आएको डाटालाई विश्लेषण गरी पाथवेको निर्माण गरियो र त्यसपछि पाथवेलाई समुदाय स्तरमा गई कम्युनिटी भ्यालिडेसन गरियो। त्यसपछि एसीएफ टिम र नगरपालिका स्वास्थ्य शाखाको टिम र बेलका नगर प्रमुख बसी यस कार्यक्रम सम्बन्धी 3 दिने कार्यशाला गोष्ठी गर्ने योजना बनाई। यस कार्यक्रममा पालिका स्तरीय खाद्य सुरक्षा समिति, 7 वटा विभिन्न शाखाहरू स्वास्थ्य, कृषि, पशु, महिला तथा बालबालिका, शिक्षा, सामाजिक र खानेपानी, प्रशासन लगायतका यस नगर क्षेत्रभित्र काम गर्ने विभिन्न गैर सरकारी संस्थाहरूलाई पनि यस वर्कसपमा निमन्त्रणा पठाई 3 दिने कार्यक्रम सम्पन्न गरियो। 3 दिने कार्यक्रममा बनाइएका योजनाहरू यस 3 दिने कार्यशाला गोष्ठीमा रिसर्च टिमबाट प्रदेश र केन्द्रको पोषण अवस्थाको बारेमा डाटा प्रस्तुतिकरण गरियो। त्यसपछि समूह छुट्याई समूह अभ्यास गरियो, जसमा 20 वटा पोषक निर्धारक इन्डिकेटरमा रहेर हामी प्रत्येक ग्रुपबाट पाथवे निर्माण गर्यौं।
नेक्स्ट स्लाइड।
त्यसपछि पाथवेमाथि प्रस्तुतिकरण गरियो। त्यसपछि कम्युनिटी भ्यालिडेसनबाट आएको पाथवेलाई रिसर्च टिमद्वारा प्रस्तुतिकरण गरियो। त्यसपछि हामीले बेलका नगरपालिका भित्र रहेको पोषण सम्बन्धी सञ्चालित कार्यक्रमहरूको भोटिङ गरियो र अन्तमा हामीले बीचमा गोलो सर्कलमा बसी बीचमा एउटा कुर्सीमाथि एउटा बोतल राखी त्यो बोतल एउटा कुपोषण बच्चा हो भने हामीले मान्यौं। यसरी त्यही कुपोषित बच्चा माने त्यो बच्चालाई कसरी सुपोषित बनाउने अनि हामीले आफ्नो क्षेत्रबाट के गर्न सकिन्छ भनेर आफ्नो विचार धारणा राख्यौं। त्यही धारणाबाट रिसर्च टिम द्वारा 6 वटा सेसन विभिन्न कार्यक्रमहरू गर्दा मोडरेट माम बच्चाहरूको आमालाई 1 महिनामा बोलाई विभिन्न विषयमा वडाहरूमा जनचेतना जगाई बच्चाहरू कसरी सुपोषित बनाउन सकिन्छ भन्ने बारे जनचेतना जगाउने कार्यक्रम डिमोन्स्ट्रेसनका कार्यक्रमहरू सञ्चालन गरियो। साथै प्रतिबद्धता जाहेर गर्दै यस कार्यक्रमको प्रमुख अतिथि नगर उपप्रमुखद्वारा कार्यक्रम समापन गरिएको थियो। यसरी नै यसै कार्यक्रमको आधारमा हामीले राष्ट्रिय योजना आयोगमा प्रस्तावना प्रपोजल पेश गरे र सोही आधारमा मोडरेट वेस्टिङ इनिसिएसन कार्यक्रम सञ्चालनको लागि राष्ट्रिय योजना आयोगबाट अब 82-83 मा यस नगरपालिकाको लागि 3 करोड रकम विनियोजित भयो। सोही अनुसार हाल हामीले यो कार्यक्रम बेलका नगरपालिकाको वडा नम्बर 1 देखि 9 सम्म सञ्चालन गरिराखेका छौं र यो जानकारी हामीले एसिएफ लगायतका संस्थाहरूलाई, पार्टनर संस्थाहरूलाई पनि हामीले जानकारी दियौं।
Awesome, thank you. Okay, so continuing on with the key outcomes and successes of the program. So the first being improvement in nutritional status. We had about 81% recovery rate, meaning that 57 of the 70 enrolled MAM cases had recovered as healthy after the 3-month intervention period. The second point being operationalized. So we successfully translated the country's multi-sector nutrition plan into practice through a multisectoral intervention package, which combined nutrition, food security, and agriculture to tackle moderate wasting. Point number 3, we adopted a health system strengthening approach, improving existing service delivery, in which we trained the health workers and female community health volunteers to identify and management of moderate wasting cases, while we also developed an MWI handbook for health workers to help with service delivery. The fourth point, enrolled within the government health system. So the sessions we provided through health workers at different government health facilities to ensure program continuity. Along with that, we also used government health information management system tools for recording and reporting using the government health cards and the government registers as well. For point number 5, we developed a locally adapted, cost-effective, and scalable intervention package, which can be replicated across other local levels. So the focus was on local food promotions, adopting better hygiene behavior practices, and reducing reliance on specialized nutrition products. The last point being that we ensured strong ownership by local government to ensure program long-term sustainability and continued implementation even beyond the project timeline, which previously Binod also has mentioned that 𝗙𝗏𝗀𝗶𝘀 municipality has received a special grant from the National Planning Commission for the program continuation. Next slide. Talking about the challenges, the first one being limited human resources. So within the government health facilities, there was understaffing of health workers, with some health facilities having only 1 or 2 health workers working during the time. And also with the staff turnover, with the trained health workers transferred to other municipalities and health facilities as well. The second point, there was inadequate infrastructure at some of the health facilities, especially lack of water storage and hand washing facilities. Also, most of the health facilities did not have measuring equipment such as height board or MUAC tape or measuring scales, and they lacked cooking equipment for demonstrations as well. The third point, for behavior change and adoption, the community already had poor feeding practices due to the cultural beliefs, the food taboos, and they heavily relied on consumption of processed food. Also, because we had a short project duration, this also slowed down the adoption of nutrition practices. And lastly, about external weather shocks and unanticipated disruptions. So during phase 2, we had heavy monsoon floods, which resulted in emergency response. And in the phase 3 in September 2025, the nationwide 𝗙𝗍𝗍 movement also halted the program activities. Next slide. So lastly, talking about scale up. So the first one being that based on the findings from the MWI program, we are implementing it in other projects as well. So within the European Union funded change projects, we will be conducting the rapid nutritional determinant assessment study within 16 subnational levels of 8 districts of Madhya province. And the last one being the special grant from National Planning Commission, which is to ensure program continuation in 𝗙𝗶𝗀𝗶𝘀 municipality. Thank you so much, and hope we'll have questions at the end.
Thank you, Samyukta-ji. Thank you, Binod sir. It's very nice to hear the experiences of Nepal, and most importantly, hearing Binod sir explain the importance and the impact of involving the government entities right from the start, and the implications that had on the decisions they had to make with regards to better treatment for moderate moderate wasting in 𝗙𝗶𝗀𝗶𝘀, the judge tool in Ethiopia. Thank you.
Thank you very much, Martha. Can you hear me?
Yes, we can hear you.
Okay. Thank you. Thank you very much. Good afternoon, everyone, and thank you for joining this webinar. You see from the right side of the slide, Ethiopia has already have an implementation roadmap to operationalize the nutrition-centric humanitarian development peace triple nexus approach since 2023. So we have 6 phases to operationalize this initiative. We have done the first 3 parts about the situational analysis and consultation of stakeholders and development of operational guideline and implementation roadmap, and also launched officially at national level. So now we are rolling out this initiative through different partners, and we are working on the meal framework and advocacy guideline. Today, I will share the Ethiopian experience in translating the nutrition-centric humanitarian development peace triple nexus from a design into the practical action. Our experience focused on one simple question: just how can humanitarian development and peace actors plan together instead of working separately? To answer this question, Ethiopia developed a joint assessment tool and integrated it into the government planning system. During the next few minutes, I will explain why this approach was needed and how the tool was developed, and what we learned from the implementation, and how Ethiopia is presenting the national scale-up. So let's begin with the Ethiopian needed the triple nexus approach in the first place. As you see from the slide, this slide is framing the national context. Actually, Ethiopia has a large, young and productive population of roughly 130 million, which represents a real demographic dividend. At the same time, overlapping the climate shock, disease outbreak, displacement, inflation, and inflations are sustaining the humanitarian needs and also impacting in achieving the development goals. For example, in the last 5 years, in the country, the starting prevalence is stagnating around 39 up to 40%. So therefore, the government is now responding through strong policies, institutional reforms, and increased domestic financing and laying the foundation for humanitarian development peace nexus programming. So let's see how we turn this commitment, the government commitment, into the practical action. So first, next please, next please. So first, by creating an enabling environment. The government has created the enabling environment through established costed warada based planning tool. This tool actually is the 𝗘𝗶𝗀 Declaration innovation. So primarily what we did is that high impact and low cost food and nutrition interventions have been identified across signatory sectors. Here in the policy, there are more than 14 sectors have already signed on the food and nutrition strategy. So these signatory sectors has already identified the key interventions. And the costed warada based plan is now produced annually with a federal and regional one-to-one matching fund. As you see, the federal has already allocated $20 million and the regions has matched 11.3 million. Actually, it is not a one-to-one, but based on their capacity, they have already shown their commitment at the regional level. So the inception for, in this case, we are using this opportunity, the government platform, we have embedded the inception phase of the triple nexus activities into this plan. For example, in the current 2026-27 plan, it has already included. Now, the joint assessment tool has already been tested and applied in 2 regions of 2 waradas by 2 different partners, especially in Oromia and the central Ethiopia. So now I'm going to explain how was the joint assessment tool developed. Please, next slide. Okay, thank you. So the joint assessment tool was built through an iterative and consultative process. We had a lot of consultative process. We began from a general framework. Just we have put as a national how this joint assessment tool will be developed, just using as a guide of a general framework. Then this general framework is refined with the National Technical Working Group. We have already established this technical working group during the development of the guideline. And then we tested it, and during the SOS Children Village Ethiopia, Nutrition Centric Humanitarian Development Peace Programming in April 2025. This is a great opportunity for us. And then 2 further consultative workshops and national validation in May and September 2025 were conducted and produced the adopted 3rd version, what we have now at hand. And the key message here is that the tool reflects a genuine consensus across humanitarian development and peace actors. So now let us look at what the joint assessment tool actually does. Please, next slide. Okay, here, as you see, this is the general framework of designing or building the joint assessment tool. So we could say that this is the analytical background of the tool. Every assessment runs across 4 components. In triple nexus approach designing, everybody has to pass through these 4 components. For example, the contextual analysis, the first one, and the second one is stakeholder analysis and engagement, and the third one is vulnerability and needs, and the 4th one is we have to assess the existing capacity and risks of the intervention area. So each of these is examined through all 3 pillars. As you see, just we have seen as humanitarian and development and peace pillars according to the four components. So the table illustrates how the purpose, issues, and tools differ by pillar. It's actually it differ, but we are ensuring a single shared assessment captures the full nexus picture. As you see, just we have seen that, for example, when we do the contextual analysis, we have to know that the purpose why we are conducting a humanitarian assessment and which issues has to be focused on, and the tool we have already entertaining in different parties at the national or global level, we have to see that tools also. The same thing is true, the development and the peace pillars will be going through for each four components. So the joint assessment tool helps different sectors understand the same situation using one common framework. This does not replace sectoral, sector-specific expertise. Instead, it brings different perspectives together into one shared analysis. Developing as you know, developing a common tool was not always easy. So let me briefly share what we have learned so far. Please, next slide. Next slide, please. Martha, okay, thank you. Yeah, this is a challenge and success. Here we are candid about what was difficult and what worked. The main challenges were securing a participation of actors, conflict of interest over which indicators to include. As you know, different actors, they need to include their own indicators in the joint assessment tool. That would be one of our challenge. And the other thing, lack of flexible long-term funding. So these were mitigated through official engagement of actors and governance by agreed indicators in the operational guideline, and also using short-term catalytic funding to generate evidence. Even if you have no long-term funding for this process, just we are using the existing catalytic funding to generate the evidence. The result is, as you see, the result is a living and standardized assessment tool and capacitated the nexus actors with clear opportunities to operationalize the multisectoral nutrition action plan. As you see, as an opportunity, we have used the Sokoto Declaration Posted Warada Based Plan tool would be one of the opportunity for us to agree or to bring the participants on board, because this tool is a government tool. And also we have used the catalytic funding of the SOS and Action Against Hunger. And also now we have an adaptable joint assessment tool which accommodates all partners or stakeholders or actors. And we have already used as an opportunity of the principle of comparative advantage of OCID and DAC. So this is what we have opportunity, and also the SIDA and the Norway funding for Action Against Hunger, which is one of the iconic program which is implemented by Action Against Hunger. This would be one of our opportunity to go forward to this initiative. The next step is moving from successful pilot to nationwide implementation. Please, next slide. Okay, this is, I think, the last slide. So Ethiopia has now developed a serious rollout strategy. The first priority is to accelerate implementation so that the approach becomes operationalized nationwide. And the second one is to integrate the triple nexus into existing government coordination, planning and monitoring system, rather than creating a parallel structure. The third one is to continue generating evidence, documenting lessons, and strengthening advocacy for additional investment. The overall goal of this strategy is not simple to expand the use of one full. The goal is to institutionalize the integrated planning within the government system. So this is what we have. The progress has only been possible through a strong partnership. Just I would like to appreciate our partners and especially the government of Ethiopia and 𝗘𝗿𝗊𝗶𝘀𝗵 Declaration, the Global Nutrition Cluster, and technical working groups, implementing partners, and all supporting donors. I would also thank our partners, Action Against Hunger country, Ethiopian country office, the Nutrition for Development, and for the team for their consistent technical and financial support, and also the SOS and the Hunger Project Ethiopia for mobilizing a catalytic funding and supported the joint assessment tool. In closing, Ethiopia is experiencing shows that the joint assessment tool is more than an assessment instrument. It is a practical way of helping humanitarian development and peace actors work from the same evidence, agreed on common practices, and strengthening the government-led planning. So we hope our experience contributes to the growing global discussions on how the triple nexus can be operationalized through the national system. Thank you very much for your attention. Looking forward to your questions and discussion. Back to you, Martha. Thank you very much.
Thank you, Asmamaw. And I'm very grateful, and I'm sure everyone is glad and will be ready to learn from you. Kudos to Ethiopia, saying how far you have gone in the MSNAP path or journey, where you already have costed plans. You have this joint assessment tool that brings everyone on board. I think that's quite a good experience. We can learn from you. I hope these will be shared globally at some point. To everyone, I think we can, before we answer your questions, I see there's quite a couple of questions that have come in, but before we get your questions, we felt it relevant to have a very brief plenary conversation with our presenters from the 3 countries for them to share with us with regards to a few aspects in terms of expansion, in terms of needed support, in terms of experiences. So bringing you, Asmamaw Bark, and Samyukta, and Binod Sa, and Karima, I'll begin by presenting the first question, and maybe we'll have Karima take the first stab at it, followed by Samyukta, and then maybe Binod. From your perspective, what needs to happen within your country to continue the progress on and hopefully the scaling up of the comprehensive multisectoral subnational planning? Karima, do you want to take this on first, or should we have Samyukta? Yeah, please go ahead.
Yeah, thank you so much. I think what we have done was a very learning process for us, not only for Ministry of Planning and the SUN Secretariat, but also for our partners from the UN agencies, especially at the subnational level. We noticed how they were eager to have one joint plan for district level, and also they were very supportive during the mapping exercise. So what we really need is to build on this momentum with our partners. We need the technical assistance, we need the financial resources to ensure that we are continuing what we are doing in the already district level MSNAPs, but also it is very critical to scale up to the other districts, and especially the priority ones. So financial resources is really required, and I think if donors listen to our initiative very closely and also try to build this connection between their programs and what we are doing, so the existing financial resources is already there. Just to to align the investment or the investments of donors and actors is really what we need. We have many coordination mechanisms, we have capacities going on in the country in different areas. So just to align all these capacities, resources together behind the MSNAP and its approach will definitely be required and will help us to make real progress on ground, not on paper. Thank you.
Thank you. Samyukta, anything to add for Nepal space?
Yes, I think from our side, it would be to strengthen the local government ownership and try to integrate the projects within their municipal action plans and also try to have it within the budget itself. However, in case if the budget is not adequate, then of course, similar to the experience in 𝗙𝗏𝗀𝗃, we can also have applying for special grants to secure and integrated within the routine health system. Another thing would be to have functional governance bodies. For in case of Nepal, we have the local level nutrition and food security steering committees, which have representatives from different 7 sectors, so that we can integrate the community challenges into the national level planning. And also strengthening of the data systems as well, ensure that there is routine anthropometric tracking and routine monitoring done from the subnational as well as the national level. And lastly, I think it would be human resource capacity building through trainings to ensure program continuation.
Thank you. Asmama, is there anything that needs to happen so that we continue this progress? You've talked about the areas where this JAT tool has been done, where the coastal plans have been done. How then do we move from just the few areas but to all the areas in the country?
Yeah. Okay. Thank you, Martha. Can you hear me?
Yes.
Yeah. As Ethiopia, just you know that we are moving forward, and as a country, to continue our progress and also the scale up of this initiative, we have already exercising, but the first thing what we need is to work with the Ethiopian Disaster Risk Management Commission and also the humanitarian country team, most humanitarian partners and other platforms in the country, in the region or in the globe, to scan and identify the high priority, especially crisis affected and malnutrition prevalent areas first. This is what we need to do, and also exercising such a kind of practice in the country. Then we have to solicit funding to implement at least the inception phase of this triple nexus approach strategy. For example, the critical activities what we need to support for funding is that one is we have to organize a capacity building training for our Nexus working group in the Food System and Nutrition Council or Technical Committee at Warada and regional level. So in this case, we have to give the concept of this triple nexus for them and also how they are going to use this joint assessment tool. The second one is where we are going to conduct the context-specific, risk-informed, and gender transformative assessment using this adaptive joint assessment tool. Then we can organize a technical consultative workshop with Nexus working group and other stakeholders to analyze, interpret, identify relevant health and humanitarian development peace interventions and agree on shared outcomes. And then finally, they will design the nutrition-centric humanitarian development peace triple nexus program. After this, we are going to establish or organize a regional or national level, high-level advocacy workshop to engage decision makers and donors in financing the gap to fully implement the designed program. From here, just we have already the government commitment, but in terms of the current context and the gap we had, just we have mobilize additional funding from the donors to match for the government investment. This is the second one. The third one, we are continuously learning, evidence generation, documentation, and dissemination of lessons at national, regional, and global level. This is what we need as a country. Thank you. Back to you, Martha.
Thank you, Asma'u. Question for all of you, in each one taking just a minute or even less. How can platforms such as the SUN or coordination mechanisms such as the SUN and the GNC and any other global actors, investors, partners, how can they enhance their support to your countries in an effort to supporting the multisectoral planning for nutrition? What do you need from platforms or coordination bodies or even partners in relation to moving forward with your MSNPs?
Shall I go first, Martha?
Please, thank you.
Okay, thank you very much. Still from the SUN and the Global Nutrition Center and other cluster and other global actors, we need a support in terms of information sharing regarding evidence, data, capacity building, and also funding opportunity. The second one, we need a facilitating and coordinating efforts and experiences in a way countries to share their lesson, similar to today's webinar. And the third one is providing technical support for countries in need. It would be one of the expected need from the SUN and the GNC. This is what I suggest. Thank you.
Thank you. Any additions, Samyukta, Karima? How
no,
should the SUN or the GNC support you?
Yeah, I think it was already mentioned what he said. I think the first thing is obviously funding mechanisms to, because all plans require funding to move forward as well. And then obviously technical assistance to the subnational levels, be it in the form of contract-specific intervention packages or operational frameworks. And also if they could fund operational research so that we have real-time learnings and that could be scaled up.
Yeah, thank you so much. I think
Okay.
first of all, we actually would like to highlight and acknowledge the support from GNC during this process. It was really helpful. The flexibility of the support was also critical, and that's really what we want from the GNC, from the SUN, is to show this kind of flexibility in technical support, and also channeling this investment, spreading the word among the global partners and also donors. So this platform of GNC and the SUN can help us to link the country level needs with the initiatives at the global and regional levels. So yes, supporting the Yemen in scaling up. So 2 governorates are not enough, and to scale up is critical, and this is what we look for from the GNC, the SUN, the Global SUN movement, and the Convergence Hub within the SUN movement to support us to follow through, and also to build and establish learning not only for Yemen but also for other contexts similar to Yemen. Thank you.
Thank you. You've pretty much answered my second question, so it feels like it's going to be relevant, but I will try and ask it anyway. You've talked about the GNC supporting you in terms of continuing to share these country experiences, but are there other ways or other platforms or other methodology approaches you think we could apply to ensure that we are really continuing the sharing of these country experiences? And most importantly, at the national level, how do we get these experiences and these conversations up to even the subnational level in terms of planning or better planning for nutrition programs?
Yes, I think one entry point for this is that we have the nutrition cluster, the national platform, and also we have the hubs of the nutrition cluster at the subnational level. So starting from this point, that the humanitarian platforms will jointly work with the SUN Secretariat, with the government, will be like, the most important linkages between these actors, and will help us to maximize the efficiency of the investment in Yemen for nutrition. And I think this applies to a context where we have different mechanisms and platforms at national, subnational level. It is a matter of linking them together and also working together, not only the nutrition cluster, but also with WASH, education, and food security clusters, as they are the most impactful ones on nutrition. I hope I answered your question. Thank you.
Thank you. We still have a few minutes, and I think we can now go into the Q&A. We don't have any questions because most have been answered already, but please, the floor is open to everyone to share their points or their questions or concerns. I think I did see Machar's hand up, but I don't see it up anymore. Please do raise your hand, and we will allow you to ask your question or make your suggestions or additions. Thank you. Any questions, additions? I do not see anyone putting up their hand, so I'll not take a lot of your time. As you gather your questions, I think for me, what I get from this conversation today is that multisectoral planning has taken place, can take place, and can be operationalized. So we can do it, and we should be able to do it. All that, it's very important, I think, for all the three countries. What comes out clearly is you must involve all the stakeholders. You must analyze the context. And I think the beauty of most of these tools that we've looked at, and especially also the GNC multisectoral planning toolkit, is when you are doing this context analysis, you should try as much as possible to go to the most local level as possible, because it gives you that perspective that may not necessarily come out of the general, regional or country level data, but also gives you a nuanced understanding of the determinants on the ground and what determinants are important for the community that you are trying to serve. And this is really what really eventually makes the multisectoral engagement along the building blocks get much better, because you don't only base on what you think is the challenge on the ground, but actually what is really the challenge or the determinants on the ground. I think for all countries, we have seen Karima talking about the importance of the the context analysis and how and the relevance of you linking the data that you have with the programs that you're going to promote. And for all the three countries, we see a lot of linking your existing resources with the data that you have, linking your existing resources with the technical resources that you have, and also the programmatic resources, which is a very important thing. Nepal has really emphasized, thank you, Binod sir, the benefit of bringing the government people on board right from the beginning. And for Ethiopia, the whole aspect of saying, do not do the assessments, do not do these contextual analysis in silos, but do them in a collective, do them including all the sectors, and have everyone participate in the doing, not simply saying we're doing Move on and get your plans costed, move on and get actions done. If it has been done in one or two areas or in one district or one municipality, we're definitely sure it can be done in another municipality. And overall, they need to make sure that we integrate or we get involved or inbuilt into the existing systems or the existing national level planning and financing mechanisms. I can see John Kur's hand up. Maybe we can give him a minute. John Kur, please unmute and go ahead and speak.
Yes, good afternoon, everyone. This is Banur John from South Sudan. Thank you very much, all the country they present. Really, that is a good initiative. The multisectorial, like, is a one initiative really to help us in all the country with our issues. Like, I need Ethiopia or the Nepal to show us the experience. Like in South Sudan, we have like the different system, the data system. We don't have one data system in country really. As we go with another line ministries like agriculture, education, also the parallel system. How did they come? Did they come to? Did they harmonize the system for us to implement the multisectorial operational plan? And thank you very much.
Thank you, Banur. Asma Mao and Samyukta, do you want to come and share in terms of how you use the data from the different sources?
Okay, thank you very much, colleague from South Sudan. I think, yeah, that's a great question. Most of the time, the data issue is a challenging part in operationalizing the triple nexus approach. But luckily here in Ethiopia, the government has already implementing one, the UNIS system, the nutrition information system, which is unified across all sectors we have as a multisectoral. So those indicators or implementing interventions in this platform, so we can get this report in a monthly, quarterly, and annual level. So this data will also reflected on the DHIS2 of the country, the ministry. So this platform will be used for us, but now we are thinking to integrate some indicators of the triple nexus approach, monitoring and evaluation issues into this platform. Thank you. Back to you.
Thank you, Asma Mao. Samyukta, do you have anything in terms of how you collated the data from the different sectors? Maybe just to add on as we wait for Samyukta, but now what I think there's a way within these toolkits and the GNC toolkit in particular, for which I can speak for, is there is a way you can collate all this information from different sectors to be attributed to the overall picture of understanding, but most importantly, prioritizing which determinant will be considered important for the community that you want to provide the nutrition intervention for. So it's not that you want the data to be able to say this nutrition situation is bad. You can have the data that says the nutrition situation is bad, and that could be the DHIS or whatever. But then you can use the data in other forms and other surveys, whether qualitative or other, to give you that nuanced understanding of the context. And I think that was done in Yemen in that particular case. If I think we could be able to share with you some discussions and conversations. But unfortunately, we have come to the end of our webinar. Thank you so much for your time, for your presence, for your questions. We will be sharing all these with you sooner than later, slide. But as you leave within the GNC, We are very much available to provide you support on the toolkit, either implementation or support in other aspects in nutrition in emergencies. We could be able to help you in terms of hiring consultants, in terms of getting technical support, but also getting peer support through the ENET platform. ENET currently also has put up a WhatsApp that you could join and be part of to learn more. Please do visit our website, that is nutritioncluster.net, and through that you can be able to request for support, or even now you can simply scan the QR code and it will take you direct to our website, which looks like next slide, which will look like that, and just go up and request for support, choose the language you want to engage with, and we'll be able to get to you as soon as we can. Thank you very much for your time. Asagna leo, Danyibad, Asante Sana, Shukran Jazilan, and merci tout le monde. Please do help us fill a brief webinar evaluation. It won't take very long. Just a question on the evaluation. We had a very small glitch. We indicated Spanish instead of Nepali. So for those who listened in Nepali, please just tick the Spanish bit when you're responding to the questions concerning language. Thank you very much. Do have yourself a good rest of the day. Bye to everyone.
Bye-bye, Martha. Thank you. Bye-bye, everyone.